Capital Views is sponsored by Northrim Bank, Alaska Oil and Gas Association, ConocoPhillips, and Linden.
Hi, I'm Tim Bradner with Alaska Legislative Digest, and welcome today to Capital Views and to Commissioner Heidi Hedberg, the Commissioner of the Department of Health. Commissioner, welcome. Thanks for joining us.
Yeah, thank you for inviting me.
The Department of Health, you got a big set of responsibilities on your lap. The department covers so many things, SNAP benefits to Medicaid to infectious diseases monitoring, now the new federal health transformation program, a big, huge opportunity for Alaska. Maybe walk us quickly, real briefly, kind of all the ranges of things the department does.
Yeah, Tim, that's a great question. And so about 3 years ago, the Department of Health and Social Services was reorganized, and the Department of Health has 5 divisions. So I like to think of it as the systems that support Alaskans. So we have public health that manages all of the public assistance programs, public health that is really out in community with education, infectious disease surveillance and treatment, working at that crossroads of what are the public health factors in the community, how can we make the population healthier, to behavioral health. And we've done a lot of work around strengthening our behavioral health system. And then we have healthcare services that manages the Medicaid program and the background checks and the licensing of various types of facilities. And then finally, we have our seniors and disabilities services division, and that supports our individuals who are in home and community-based waivers and our infant learning program and helping seniors age in place. So it's a wide swath of divisions, but really think about the Department of Health as very much of a system focus supporting Alaskans.
That's a lot. Commissioner, I think we've spoken in the past about the SNAP benefit programs and now the Medicaid. A lot of changes, a lot of issues and problems in the past have come up. As I recall, there's been some new technology upgrades that have eased some of these problems. But where are we with? Are you able to keep ahead of the curve with SNAP benefits? And now the Medicaid re-enrollment is a big challenge too. Just the technology of that, people being able to twice a year now having to re-enroll in Medicaid.
Yeah, Tim. Very much. So we are very thankful for the legislature and their appropriation a couple of years ago to focus on public assistance and those IT system modernizations. So we have milestones, and we have completed the first milestone. We're working on the second milestone, and we're really excited to be breaking ground and moving our various programs off of the legacy systems that has just truly plagued the department and really frustrated our clients in accessing their benefits. And that the contractors some are working on Medicaid right now, getting SNAP off that legacy system will start this spring. And that work will be completed in 2027. And so we're really excited to be looking at a new integrated eligibility system so that clients can see their information, track where they're at with their applications, that they know when their interview is up or when they need to renew their benefits. So, and it will be much easier for eligibility technicians as well. They're not going to be toggling between all of the different screens. They'll have one system that's fully integrated.
Well, that's encouraging. Is that going to roll right into the Medicaid re-enrollment program too? The same system, the same people?
Yep. So we have a group of fantastic eligibility technicians, and so they're the ones that manage all of the public assistance programs, including Medicaid, like you just asked, Tim. And what is new that's happening at the end of 2026, so the end of this calendar year, something called community engagement requirements. And so for a small subset of our population, they will be renewing every 6 months and demonstrating that they are working, they're volunteering, or they're in school so that they can stay on Medicaid.
As I recall, one of the differences between Medicaid and SNAP benefits is that the food assistance requires a personal interview under the federal rules, and Medicaid does not. So that's an additional complication. But you're able to. It sounds like you're able to set up to handle that. Okay.
We are, yeah. So for SNAP, individuals that are on SNAP, we do need to do an interview, and that's going really well. And we're staying on top of those SNAP interviews. If you're on Medicaid, you don't need an interview. And really what we're trying to leverage the technology is that there's an automation to it, so it can take the burden off of the client and the eligibility technician with the appropriate checks and balances.
Well, you're making progress. That's encouraging. Commissioner, the newest thing on the block is really the big federal new rural health transformation program. Opens up a lot of opportunities and
Yeah, it does.
exciting possibilities.
Mm-hmm.
What
Yeah.
does what does it do, just in kind of a nutshell?
So the Rural Health Transformation Program is really a generational opportunity to take this funding and to make the changes that we have been discussing all along. We see in our Medicaid data, right, that we have, a lot of Alaskans with chronic diseases. 75% of Alaskans have one or more chronic diseases, and that's a big cost driver. So how do we focus our system from paying for acute care to paying for prevention, focusing in on primary care? That's a big focus. Healthy beginnings, starting all the way from maternal health and our infants, making sure that they have the best start to their life. We're also going to be looking at alternative payment models. So currently we're a fee for system, and we need to really be exploring that sustainability in these different opportunities that our clinics, our hospitals may evaluate and say that's something that I'm willing to move into. And then I think the third goal or element is really focusing on technology and how we can leverage technology as a tool to help the patients, help the clients, and our workforce. We very much need to strengthen our healthcare workforce.
And Commissioner, how much money is this expected to bring in? 250 million a year or so?
Yeah, so the first year, we were very thankful. We were very competitive. Our first award was $273 million.
Oh, good.
Every year is going to change. If you were to take 273 million, that could be a potential of about $1.3 billion over the course of 5 years. So it is very much of a generational opportunity to make a really big change, but we need to do it together. We need to work differently, and we need to partner differently so that we really can take advantage of this opportunity.
Well, in other words, we're going to have to really get our act together now that we've got the opportunity. So not that we haven't had it together before, but now we've got resources to work with.
We do.
Commissioner, thank you very much for joining us, and look forward to discussing this further.
Thank you, Tim. Take care.